Good evening. Hi, my name is Jennifer Pillars. I am a registered sleep technician and respiratory therapist at KSB Hospital. Today, I would like to talk about sleep hygiene. What is it, and how can sleep hygiene improve our quality of sleep? During this presentation, we will also be discussing when is the right time to talk to your physician about having a sleep study. Sleep is essential to both physical and mental health. Getting quality sleep doesn't just feel good, it's important for your health. It strengthens your immune system, helps you maintain a healthy weight, and lowers your risk for serious health conditions such as diabetes and heart disease. Good quality sleep can also improve your mood and even your memory. While you sleep, your brain forms new pathways to help you remember information. What is sleep hygiene? Sleep hygiene is a variety of different practices that are necessary to have normal quality nighttime sleep and full daytime alertness. Sleep hygiene can be the difference between a restful night and a restless one. The top 10 sleep hygiene practices. Number 1, regular sleep schedules. Go to bed and wake at the same time, give or taking 20 minutes even on the weekends. This sets our internal clocks and trains our bodies when to be awake and when to rest. Even if you have a restless night, try to stick to the schedule you maintain. This will help you get a better rest the following night by increasing your sleep drive. Number 2, creating a relaxing bedtime routine. A warm bath, reading a book, listening to soft music, etc. Relaxing an hour before bedtime helps us transition into sleep more effectively. Number 3, cool the room and lights out. Studies have shown keeping your room cool and dark is ideal for restless sleep. A dark room releases melatonin in our brains to promote sleep. Melatonin is a hormone that is released that tells our body it's time to sleep. Number 4, low lights after dark. Consider dimming the lights in the house after dark. Natural light is important during the day to maintain our circadian rhythms, which is our body's internal clock. Bright lights from cell phones, laptops, lamps can interfere with our sleep-wake cycles, making it harder to fall asleep. Lights will also hinder the release of melatonin when it's time for us to rest. Avoid stimulants late in the day. Studies show if you are having trouble sleeping, you should avoid stimulants and caffeine at least 6 hours before bedtime. Avoid coffees, teas, chocolates before bedtimes as they can trigger for a restless night. Get regular exercise. Regular exercise improves quality of sleep. After a few weeks to a month of regular exercise, it has been proven to make a substantial effect on sleep quality and efficiency. If you struggle with sleep, only use your bed for sleep. This means refrain from watching TV in bed, internet browsing. This is a good way to train your mind to see your bed as a resting place. This is an example of when people sleep with their TV on. So I'm showing you a slide of what your brain looks like in normal sleep and what your brain looks like with the TV on when you're sleeping. So your brain is being disrupted and making arousals and disruptions because it's hearing the highs and low pitches of your TV. So it's a good idea to always sleep with your TV off. Number 8, limit or avoid naps during the day. Even though a short power nap can lift your mood and make you feel more refreshed in the short term, it can decrease your homeostatic sleep drive, making it harder to drift off at bedtime. Number 9, avoid certain foods and heavy meals before bedtime. Spicy foods, fried foods, citrus fruits, and heavy meals are all tough on the digestion system and can trigger nighttime indigestion and just plain make it hard to get comfortable. Eating too close to bedtime can result in a very restless night. Try to leave a 3 to 4 hour window before eating and sleeping. Number 10, avoid drinking alcohol before bed. Even though sometimes people feel like alcohol helps them wind down at night due to making them feel drowsy, at the same time it interferes with our quality of sleep. Alcohol alters sleep architecture, disrupting the natural flow of sleep staging transitioning. Now that we've covered how to work on our sleep hygiene, so what do we do if people do have good sleep hygiene and are still struggling at night? What are the symptoms a person should be looking for? And when do they need to talk to their physician about sleep issues? Waking with a dry mouth. In normal sleep, your mouth should be closed. An open mouth at sleep could mean heavy snoring or apneas are happening. Apneas are where you quit breathing during the night. So a dry mouth is a big indicator that something's going on with your sleep. High blood pressure. Sudden drops in blood oxygen levels that occur during obstructive sleep apnea increase blood pressure and strain the cardiovascular system. Daytime fatigue. Repeated awakenings at night associated with sleep disorders make restful sleep impossible, causing severe daytime drowsiness and irritability. Episodes of gasping for air at night, morning headaches, difficulty staying awake, and difficulty paying attention while awake. These are all symptoms that you should be discussing with your physician. Sleep disorders, including sleep apnea, have become a significant health issue in the United States. It is estimated that 22 million Americans suffer from sleep apnea, with 80% of the cases of moderate and severe obstructive sleep apnea undiagnosed. Many of these patients don't even recognize the symptoms of inadequate sleep. Sleep disorders can affect anyone, but certain factors increase your risk. Type 2 diabetes, sleep apnea increases your risk of developing insulin resistance and type 2 diabetes. Excessive weight, neck circumference, a narrowed airway, family history, alcohol use, smoking, and certain medical conditions. The KSB Sleep Lab is fully equipped to educate, diagnose, and treat sleep disorders. A sleep study can uncover hidden health issues such as obstructive sleep apnea, insomnia, restless leg syndrome, REM behavior disorder, narcolepsy, and hypersomnolence. Sleep disorders can severely impair your quality of life. It is important to pay attention to your sleep habits and discuss any sleep issues with your physician, especially if you have those certain risk factors involved. Dr. Wasim Ahmad is our board-certified physician that our patients see after their sleep studies. And we also have Dr. Kim Trevoranis, who is also board-certified in sleep. Thank you for listening and have a good night.